Hey, I'm Mr. Shrum and I'm back with another anatomy walkthrough lesson guide. And today we're going to go over the pelvic girdle. Yeah, fun stuff. So here we go. Down in the pelvic region, you have the pelvic girdle. And that's part of the axial skeleton and provides the attachment point for the leg bones of the appendicular skeleton. So here we see all of the parts of the pelvic girdle, joints, sacrum, crest, ilium, hip joint, femur, all this pubic bone. Fairly important stuff. And the pelvic girdle is made up of two curved innominate bones, or hip bones, that's what we say. These bones meet on the anterior side of the skeleton and attach to the sacrum, on the posterior side at the sacroiliac joints. The legs assume the weight of the body through the pelvic girdle at these joints. And the pelvic girdle and sacrum together make up the pelvis. This bowl-shaped structure supports and protects reproductive, urinary, and digestive organs. So it may not be everyone's favorite thing to learn about, but it is important. And you can see here how there's slight differences between a typical male pelvis and a female type pelvis. We'll get into that later. But meanwhile, the innominate bones, or the hip bones, have three fused bony elements. The ilium up here, ischium, and the pubic bone. The ilium is the largest and most superior bone in the pelvis. This flaring bone that you can feel under your skin is often referred to as the hip bone. The iliac crest is a long curved ridge superior to the ilium. So above that right there, you see the crest. Now, the ischium is the posterior, inferior part of the pelvis. A bony prominence of the ischium, try to say that word, ischium, is called the ischial tuberosity. And that is on the posterior side and supports the weight of the body when in the seated position. So when you're sitting down, you may be sitting down right now, that ischial tuberosity supports the weight of the body when you're seated like this. And the ischial spine is one of two small triangular bony projections that extend posterior from the ischium. You can see that here, the tuberosity down here, and the spine, the ischial spine. And then there's the pubic bone, or the pubis. That's anterior on the pelvis and superior to the ischium. See the ischium, and then above that, right there, pubic bone. The ilium, the ischium, and the pubic bone form the acetabulum, or the hip joint. Let's just go with hip joint, but remember this other term as well. It's a cup-like depression ball and socket joint that connects the hip to the femur. So ball and socket joint right here that connects the hip to the femur. And then the round opening seen at the inferior part of the pelvis are called the Obturator Foramen. Formed by the ischium and the pubic bone, the Obturator Foramen is a passageway for nerves and blood vessels to the legs. So you see that opening? Through there are all of the nerve endings and the blood vessels that need to connect your legs to the rest of your body. And then there is the pubic symphysis, and that is a somewhat movable, that's why they say semi here, semi-movable joint at the interior of the pelvis where the hip bones meet. The pelvic girdle is slightly different in human males and females. Females tend to have a slightly wider pelvic inlet. This opening in the center of the pelvis provides enough space for a baby's head to pass through during birth. And that is it for the pelvic girdle section. So let's hide that for now and then open up foot and leg bones. Or leg and foot bones, yes. So let's zoom in a little bit. So we talked about the pelvic girdle, and then connected to the pelvic girdle are our legs and feet. The bones of the legs and feet provide support to the body and allow us to stand upright. They help us walk, run, climb, and jump. All types of athletic stuff. The bones of the leg are the femur, this long bone, kind of like the humerus in the arm. And then we have the tibia and the fibula. So similar structure to our arms. So let's take a look. The femur is the thigh bone, femur. And it's the most superior of the leg bone, connecting proximally to the pelvis and distally to the tibia and fibula at the knee joint. So it's attached proximally to the pelvis, so to the side, and then distally, so towards the limb end, it's connected to these two bones at the knee joint. The femur is the strongest bone in the body. The head of the femur is rounded and fits into the ball and socket joint in the pelvis, so up here. And then located just below the head of the femur are a neck and two processes called the greater trochanter and the lesser trochanter. The femoral neck allows for a wide range of motion with the leg at the hip joint. The greater trochanter is larger and located more proximal and lateral, where the lesser trochanter is smaller and located more medial and posterior. This diagram kind of gives you a better idea of what's happening. And muscles of the legs and buttocks attach at these processes. At the distal end of the femur are condyles, or large round bumps that articulate with the bones of the lower leg at the knee joint. Epicondyles on the femur are proximal to the condyles and provide an attachment point for muscles and ligaments. Each femur has a lateral condyle and a medial condyle. The bones of the lower leg are the tibia and fibula. The tibia, or the shin bone, is the medial anterior bone of the lower leg. It is thicker and stronger than the fibula, which it runs parallel to. The proximal end has two condyles, lateral and distal, that connect with the condyles of the femur. The part of the tibia that can be felt under the skin on the front of the leg is called the tibial tuberosity. The distal end of the tibia articulates with the foot at the tarsus. At the distal end is a process called the medial malleolus. So here is a diagram that gives you a better look at how everything is laid out. The fibula is the smaller lateral bone of the lower leg. It is attached to the tibia at both ends by ligaments. The proximal end does not reach the knee, but the distal end does form part of the ankle. A process at the distal end on the lateral side is called the lateral malleolus and is a common site for ankle sprains, unfortunately. Now, getting into the smaller bones, the tarsus, or ankle, sorry about that. The tarsus and foot have a similar build to those of the wrist and hand, but they are weight-bearing bones, so they are larger and stronger and have less mobility and precision. 26 bones make up each foot, and those are divided into 3 groups: tarsals, metatarsals, and phalanges. The tarsus has 7 tarsals, ankle bones. Here you get a look at most of them. Calcaneus, talus, cuboid, lateral, cuneiform, or the 3, navicular, intermediate, cuneiform, medial, cuneiform. But all I want you to be able to do is recognize that the tarsal bones are back here towards the ankle, this purple region here. Okay. And then as you move further towards your toes, you get the phalanges. The calcaneus, the heel, is the largest of the tarsal bones. It is located in the most posterior distal position of the foot and helps support the weight of the body when standing. The sole of the foot is known as the metatarsus, and it's made up of 5 metatarsal bones. Ligaments around them hold the metatarsals in an arch formation, and they join the phalanges, the toes, at the metatarso-phalangeal joints, or the toe knuckles. If you break that down, metatarso, that's the same as metatarsus, and then phalangeal. So just the joint between these two things. And just like in the hand, 4 of the phalanges of the foot have 3 parts: proximal, medial, and distal. Sorry about that. Proximal, medial, and distal. moving towards the end of the toe. Proximal phalanges are nearest to the metatarsus. Medial phalanges are in the middle of the toe, and then distal phalanges are the most distal part, towards the end of the toe. The parts of the phalanges are connected by interphalangeal hinge joints, which will be covered in a later lesson. Also, like the hand, the fifth phalange, or big toe, only has two parts, the proximal and the distal phalange. It doesn't have the little blue medial phalange like the others. The strongest and largest bones in the body are in the legs. The bones of the legs, ankles, and feet are part of the lower appendicular skeletal system and provide us with height and mobility. So that's the end of that lesson as well. Let's open up the issues that can occur with the skeleton. Skeletal issues. The skeletal issues, or the skeletal system, is a complex structure with a lot of capability, but sometimes issues can occur, and that may cause you pain, reduce your range of motion, and can be really debilitating at times. Some of these conditions can be prevented through healthy living, but others are genetically derived or caused by trauma, and sometimes you cannot control those. In this lesson, we'll learn about a few of the most common issues. Osteoporosis. I'm sure you've seen commercials or ads talking about osteoporosis at some time in your life. This is literally translated to porous bone, and this is a condition characterized by weak or fragile bones. And if you zoom into the bone shaft, the spongy bone with its honeycomb-like structure becomes more porous or spongy because the creation of new bone does not keep up with the breakdown and reabsorption of old bone. So this turns into this. And that makes these bones less strong. Osteoporosis is most common in older women, but men can also develop this disease. Oftentimes, a person with the disease does not know they have it until they break a bone. So that's very unfortunate. The most common fractures occur in the spine, the hip, and wrist. Fractures of the spine lead to a decrease in height, poor posture, and back pain. Some of the risk factors are age. It just increases with age. A small or thin frame, family history of osteoporosis, medications, certain medications, ethnicity can be a factor, osteopenia, low bone density, and smoking. Just avoid smoking if you can. That seems to be smoking, and then certain medications are some things that you can control, but the others are not up to you. So the symptoms, no symptoms occur until an actual fracture takes place. Height loss can be an indicator of fractures in the spine. A painless bone density test can indicate the strength of the patient's bone compared to a healthy young adult. So there are some ways to check, but not the best ways. And then treatment-wise, there's no cure, but it can be treated with medication. Prevention, a diet with adequate amounts of vitamin D and calcium can help prevent osteoporosis, as well as protein and vitamin consumption. An active lifestyle that includes activities such as strength training and weight-bearing cardiovascular exercise can also make bones stronger. Smoking can affect calcium absorption, and that leads to weaker bones. So quitting decreases the risk for this disease and countless others. Also, if a medication has a warning of an increased risk of osteoporosis, the patient should discuss this risk in depth with his or her doctor. Ideally, your doctor should bring that up to you, but in the current state of healthcare, you have to watch out for yourself. So, moving on, it's recommended that women over the age of 65 have their bone density tested, and those with more risk factors can begin testing earlier. Rickets or osteomalacia can occur in children ages 6 months to 24 months old, and this can occur in children who do not get enough vitamin D in their diet, so their bones fail to mineralize. Vitamin D is necessary for the absorption of calcium and phosphorus. And without these nutrients, bones become weak and soft. Thankfully, rickets are fairly rare in the United States. Risk factors. So what can actually lead to rickets? Little exposure to sunlight, darker skin, diets low in vitamin D, being breastfed exclusively, other malabsorption diseases, including lactose intolerance and celiac disease. So that's intolerance to milk, a protein in milk, and then celiac is an intolerance with wheat. Family history of hereditary rickets can also increase the risk. So what are the symptoms? So a child with rickets does not grow quite as normally as other children. Deformities of the bones and teeth may occur. Bone tenderness and pain may indicate rickets. A doctor can diagnose this disease through imaging tests. Treatment, how do you treat rickets? Well, replacing the lacking nutrients, such as vitamin D, calcium, and phosphorus, is one way to treat it. Preventing it. Infants who are exclusively breastfed can be supplemented with vitamin D during the first 2 months of life. Families with hereditary rickets can seek genetic counseling. So, if you have a history of this, don't have children and expect things to be different. Yeah, that's my advice. Herniated disc. A herniated disc, sometimes called a bulging, ruptured, or slipped disc, occurs when an intervertebral disc has an abnormal bulge or has an abnormal bulge, or it actually ruptures. And that fluid, the gelatinous fluid inside, leaks and irritates the surrounding nerves. So you can see this is a normal disc on the left, and then you can see the compressed spinal nerve here. And that can rupture, and that fluid can leak and cause you pain. So what are some of the risk factors? Well, aging, gender, it's actually more common in males. If you have a back injury history, if you smoke, if you're overweight, if you are not very active, and your working conditions are not very ergonomic. Ergonomic means comfortable. If you work and your body's hurting or in pain constantly, that's not ergonomic. Symptoms. Well, symptoms of herniated disc can vary depending on the size of the disc and where it's actually located. Besides back pain, a herniated disc can interfere with nerve function, causing weakness, numbness, or pain in an arm or leg. Sciatica, pain that travels down the leg, may develop if the herniated disc is in the lumbar spine. The best treatment for herniated discs: rest, pain meds, anti-inflammatory medication, physical therapy, and perhaps even surgery in certain cases. Now, prevention, exercise regularly. If you smoke, don't start to smoke and quit. Don't smoke. Proper lifting techniques. Use correct form. I know many people that have picked up a somewhat heavy object with bad form and that tweaked their back somehow. So be careful. Maintaining a healthy body weight and good posture. Sit up, shoulders back, neck extended upward. You don't want to slouch over, and strengthen your abdominal muscles and your lower back. The next issue, spinal curve issues. Kyphosis is an outward curving of the spine in the upper back that appears as a rounded hunchback with slouched posture. When this condition occurs in adolescence, it is called Sherman's disease and is caused by the wedging together of several vertebrae. The cause of this condition in adolescence is unknown currently. Risk factors. Well, other conditions of the spine can be risk factors for kyphosis, such as arthritis, disc degeneration, fractures or injury, scoliosis, and slipped vertebrae. Other risk factors: tumors, muscular dystrophy. So if your muscles actually get smaller and weaker, connective tissue disorders, infection, such as tuberculosis, diseases like polio, spina bifida, and others. Symptoms: round back appearance, mild pain, fatigue, tenderness and stiffness in the vertebrae, and difficulty breathing in super severe cases are all symptoms of kyphosis. How do you treat it? Well, depending on the cause, how they treat this issue can vary. If this develops in the womb, a corrective surgery at a young age is required. Sherman's disease only requires surgery for large and painful curves, but is otherwise treated with physical therapy and a brace. Usually, if pain is not an issue and no other critical conditions exist, surgery is not required. However, if neurological symptoms or persistent pain do exist, surgery is necessary. Prevention, there's no known way to prevent this disease, but treatment and prevention of osteoporosis can prevent this issue from developing in elderly people. Lordosis is an excessive curve of the lumbar spine, also known as sway back. And this is near your butt, your buttocks. And this makes your butt appear more prominent. And that's because your spine is curving in an unusual way. A small lordotic curve is normal, but lordosis is evident when a person lies flat on the floor and has a significant space between their back and the floor. So lying face up, if this person's lying down, for example, and there's a large portion between the back and the floor, that may be a sign. Risk factors: obesity, being overweight, and other bone conditions such as the previous one we discussed, kyphosis, achondroplasia, a form of short-limbed dwarfism, and osteoporosis are the major risk factors for lordosis. So typical symptoms may be low back pain and literally a visual curve in the lower spine. You can see it. Treatment: if the back has enough flexibility that the curve reverses itself when the person with this condition bends over, and if they are not in pain, no treatment is necessary. However, if treatment is needed, the following options may be considered. Medication for pain relief, physical therapy, braces to control the growth of the curve, weight loss, and actual surgery in some cases. Prevention: well, strength training, flexibility training, maintaining a good posture, and maintaining a healthy body weight can help prevent this issue. Scoliosis, perhaps, I think this is a little more popular, more well-known. Scoliosis is a lateral curvature of the spine, creating an S or C-shaped curve in the vertebral column. The most common form is idiopathic scoliosis, and that develops during the teen growth spurt years and is actually more common in human females. The cause for this type of scoliosis is unknown. About 20% of cases are another form of the disease, neuromuscular scoliosis, caused by abnormal muscles and nerves. Neuromuscular conditions like cerebral palsy, spina bifida, or muscular dystrophy can result in neuromuscular scoliosis. Degenerative scoliosis is caused by a trauma to the spine or osteoporosis, and congenital scoliosis is rare, but is caused by a bone abnormality developed in the womb. So degenerative is caused by trauma to the spine or osteoporosis, and then the rarer case, congenital, is developed in the womb. So risk factors, what's going on? What makes scoliosis more likely? Well, if your family has a history with scoliosis, that may lead you to have scoliosis. Delayed onset of menstruation in females, athletics that put an uneven pressure on the spine, other joint and muscle conditions. So what are some symptoms of scoliosis? Someone with scoliosis will look like they're leaning to one side and have uneven shoulder and hips. Pain is not common with scoliosis, but it can occur. The two main treatment options for scoliosis are bracing and surgery. If the curve is between 25 and 40 degrees and the patient is still growing, usually a brace will be recommended. The curve will not be cured by the brace, but progression may be halted. For serious cases with a curve over 40 degrees, surgery is considered to fuse vertebrae together. During this procedure, the curvature is straightened as much as possible and held together with metallic implants until a bone graft consolidates and forms the spinal fusion. Scoliosis cannot be prevented, but medical attention can hinder the condition from getting worse. So, as you can see, a lot of skeletal issues can be prevented through proper nutrition, posture, good posture, and an active lifestyle. However, there are genetic factors, but they can be treated with medical care. So that's at least encouraging that we found a way to treat these skeletal issues. But I hope you found that helpful. And that is the end of appendicular skeletal system. And we'll move on to the muscular system next time. So thank you guys. Good luck with everything. And I will see you next time.